Џихане Тавила, thank you for joining us. First of all, we would like to ask you, how do you rate the current situation with the coronavirus in Macedonia? We've had restrictions during these past 2 months, but somehow now we have a huge rise of the numbers of infected. Why do you think is that so, and is this a dangerous situation that we have now?
Thank you very much for addressing this issue. I think this is a question that everybody is asking, and the people need to know. And I will be very frank and open, because we have repeated many times how serious the situation would be. And I think now we came to a very serious situation. It's very important that the people understand that this virus is a killer, and returning to the point zero, after 2 months of making a lot of sacrifices and a lot of actions and putting the measures in place, returning to point zero is certainly a great disappointment for all those who have been working very hard. And I'm thinking about the healthcare workers who have not rested, not a second, for the past few months. And I'm thinking of the doctors, the nurses, the public health workers, and also the policemen and other people who have been trying to provide essential services in very difficult situations. So, and also I'm thinking of the disappointment of the majority of the citizens who have been really abiding by the measures and also supporting the protective measures and helping to combat this epidemic just by following the protection instructions for the individual protection. So this is definitely a disappointment, but also it is a very risky and dangerous situation. North Macedonia, until the last episode, have been very successful in addressing the problem and also in facing a tremendous pandemic. This was not an easy issue, and it did not affect only one country. It has affected the globe. It has affected very hard everybody around us, all the countries around us. And it was the experience that we had to really lower and flatten the epidemic and come to a point where we have only 1 or 2 cases per day or even per few days was a success by itself. And unfortunately, people have understood wrongly the concept or the idea of relaxing the restrictive measures, and they have interpreted this as relaxing their individual protection, and this is not very helpful, because this has helped the virus to spread again and to attack everybody. Everybody can be infected by this virus, and if we do not support the protective measures, I think we will not see good results. I believe that there is still time to reverse the situation and to try to stop again the spread. This country have had a show of solidarity in the past 2 months, and I think it should continue. It is not time to just relax, and it's not time to put our hands down and forget and to lower our guard. We should not stop following the precious protective instructions. So we must continue to be very careful and also take all necessary precautions, including good physical distancing. So when we say distance yourself, we know how the virus is transmitted, and a 2-meter distancing and not crowding and not mixing up with a crowd is very important, even if it is within one family. It's very important to frequently do the hand washing and also to protect from coughing and sneezing by your elbow. All of us are looking at going back to a normal life, but I can tell you there will not be a normal life until we get vaccination for everybody. The normal now is to take our precautions, and for some time. So this is not going to stop. We better learn how to live with it and how to continue to take precautions. We all have the right to go back to our businesses, to our economy, but it should be done in a safe way to protect ourselves, the children, the parents, and the community, and it needs to be done in the best way possible. Now, the situation in the country is serious, and this is why I call for solidarity. We need to continue to increase the capacity, and people have to understand that we do not have an infinite number of doctors and an infinite number of nurses. And crowding the hospitals with sick people is going to affect not only the quality of the care for the people, it's going also to affect the healthcare workers, the nurses and the doctors, because they will not be able to handle the quality of protecting themselves and the others, and it will be really catastrophic for this sector of the people. So what we are doing by simply taking very simple measures, it does not need to have resources to just distance yourself and really take the protection necessary.
You said it is a risky situation. So what are the risks that we are facing now at this moment?
Now you are seeing it. You are seeing the risks. You are in it. It's not something to come. Now we have passed one peak of this wave, but we are now seeing another peak coming only 3 days or few days after some of the measures have been relaxed. So you are in the situation. It is not something to come. You are seeing 100 patients a day. You are seeing 4 or 5 people dying a day. The question is, can North Macedonia afford to have this number of people who are affected and infected? And I want to say something to people because they think that this is just a cold, it's just influenza, and this is not the case. I want to make it clear, and maybe also the mass media in this country have been protective to the feeling of people, and also we have been a little bit protective, trying not to put the morale down and trying always to boost and to call for solidarity and involvement in the protection. But I have to say that even for those who would have mild disease or moderate disease, there is a risk of also affection of their organs. So this virus affects the heart, affects the kidney, affects not only the lungs, and it is not always a very severe disease that you can see that takes you to the hospital. Even a moderate disease and a mild disease can have severe health consequences on the person. So this is a virus that will attack every single organ in your body. And there is no way, and there is no medication, no vaccination, nothing to stop. So all what the healthcare can do is to sustain life, to be able to, for the body by itself, to respond and to defend itself.
There are a lot of people that simply do not believe that the virus actually exists. Besides the numbers of deaths and the press conferences of the health authorities, some people simply do not believe that there is a virus. How can we raise awareness about this issue?
I think there has been a very good job of raising awareness in the country. But I think what is very extremely important is that the people also start using their logic and their reason. Ask yourself, what is bringing 100 people to be infected every day? What is sending people to a hospital in large numbers every day? It cannot be but an infection, and the virus do exist. The virus was isolated. The genetic composition of the virus was defined. We know what the virus is, and we know what it does to people. And I'm saying again, it will affect every organ. It will make your heart stop, your kidneys stop, your lungs will stop functioning. And there's nothing to do but to sustain life in this situation. So the virus exists. And those who are not agreeing, those who are in denial will be the ones who are going to bear the problems and the infection and also expose themselves and expose others. So it is absolutely important for people to believe. And I think the mass media and the telemedia and television, radio, I think you should start also discussing and talking to people who are affected themselves, to talk to also those who have lost loved ones and who have lost a child, a 9-month child. I mean, who can bear this problem? What is causing this death? We have to also use our brains and use our reasons, and I think we have to show how severe this disease is. We cannot work only on raising morals. We have to really show how much also the healthcare workers are suffering. About 17% of all cases have been among doctors and nurses. We don't have doctors and nurses. We should preserve them. We should take care of them, because nobody will be there if we have a heart attack to take care of us if they are affected. People have to understand this. And because of the denial, this is what we are seeing now. Another thing, and I will end with this about this subject, is that we should not politicize the virus and the outbreak. This is like playing with fire, and we have seen the fire ignited in the past few days. So I really tell everybody that they have to take it seriously. And I have seen for 2 months the collaboration and the cooperation of the population, and this really has made a difference. So for those who are denying the situation, they have just to look at your own experience in North Macedonia and to see how well the containment of this virus can be.
You said there mustn't be politicization about this issue. I want to ask you, what does WHO think about having parliamentary elections during this second wave of the pandemics in Macedonia?
First, we are not in second wave. It is the same wave, but it has peaked again. So we have to be clear about this. I would say second wave will come in autumn or any time later. But anyway, I cannot give you specific information or maybe speak about specific events, but what I can tell you is any mass gatherings and have the potential to act as spreading the event as super spreader of the pandemic. Now, WHO has really published very good guidelines to help the organizers to determine how and when they can safely resume mass gatherings, and also what is important is that the organizers to make rigorous risk assessment to the places where these events are going to happen, and also to look at the local context of each area, because we have seen different behaviors in different areas in this country. And also to look at the transmission intensity in those areas, the number of people who are there, the proximity, how close people are getting together, and to make sure that a system is in place to keep the people separated.
Social distance, washing hands and wearing masks. After 4 months of the outbreak of the coronavirus, can the WHO say that these prevention measures have given good results in the fight with the coronavirus? Or is WHO maybe considering another strategy in the future?
For the time being, the only future strategy would be vaccination. And this we do not have in hand. And I don't think that we will have in a few months only. There are 8 vaccination trials happening. Their safety have been tested. And now they are testing if they are efficacious, if they are protective. So we are having a very good approach and, going towards this very rapidly, but not as rapidly as we think, because you need time to test if a vaccine can protect from a virus. But what I can say, that we have data and we have evidence that using together these 3 measures is very effective. So if I take a mask, as I see in the streets here, and people put them either under their nose or under their mouth, they are not going to be protected, because the virus will enter in any places, and they are not protecting others.
Yes, so but there were also a lot of contradictory statements from WHO about wearing the masks. First, you've said that healthy people should not wear masks. Then you said all people should wear masks. What changed?
Let me clarify the position of WHO in this. I think there has been a misunderstanding. Mm-hmm. We are saying that we do not think that wearing masks alone is going to make a difference on its own. So if you wear a mask, but you touch a surface that is infected, and you do not wash your hands, by just removing the mask, you are going to touch your face. So this is important. If I want to grade what is important, the first importance is distancing, 2 meters. You add to it also another layer of protection, which is washing your hands, because you can touch any surface. And you add to it the mask. When you think there is no way, like if you go to a shop or you are taking a taxi, I mean, in the car, there is no way to have distance with the driver. So you really need to have the mask, and you need to put it in the right way, not under your nose or under your mouth. Who are you fooling? Are you fooling the government? You are going to be the first one who is affected by this situation. You are the one who will lose if you don't use your mask right, if you don't wash hands frequently, if you don't also keep a distance from each other. Don't go to the crowds, don't make crowds, and help yourself and help the community as well.
There were also some critics about how WHO coped with the pandemics. Do you think that WHO responded on time, or did we lose precious time? And could we have done anything better or different from this perspective?
I truly believe that in anything that you do, there is always a better way to do things. So it is very difficult when you are also in the middle of something that is totally unknown to be confident that you have covered everything. So we have to be humble a little bit, because this is a great problem. It's not an easy issue. This is a problem that the world has been waiting for 15 years. They were thinking that this is going to happen, and now we are facing it. But when we came to face it, countries, big countries, very well-resourced countries with capacity to examine and to warn about the virus, have not been able to face it. So it's a new situation, and I think, frankly and very objectively, that we have been really very quick, and WHO has really adapted to the situation in giving responses. All the guidelines that have been put in place, all the epidemiological surveillance, the risk communication have been very high. We have been vocal in telling the people this is a killer virus, take your precautions. But nobody can substitute a community or an individual or a country to do the right thing. People have to do the right thing. If you do not follow the guidelines, we cannot hold WHO responsible for that.
The USA decided to terminate its relationship with the WHO organization. What are the consequences of this decision on the work of WHO and the global health in general?
Yes, you have heard about this, and I think everybody knows about this. We have heard declarations. We haven't seen effective action so far, so we are not informed specifically. However, our headquarters in Geneva are looking into the issue, and they are looking also on how this retraction of funds is going to affect our programs, not only in one area, but in many areas. So the world has, I have to say frankly, that the world has long benefited from the strong collaborative engagement with the government, but also with the people of the United States. And US government and its people have really contributed and have been very generous toward the global health security and toward the global health actions over many, many decades. And it has been, the contribution has been great, and it has made a great difference in public health all around the world. So it is our wish, it is WHO wish that this collaboration continues.
And finally, what are the expectations of WHO now? Will the virus ever disappear? When will we have a vaccine? And how do we go from here?
We have seen successful stories in many countries. I would say Iceland, I would say many other countries, Vietnam. We have seen successful stories in a huge number of countries. And one of the most important part of this success is to have all of government support and to declare that the health of people is very important. And this is something you have in North Macedonia. But what we do not have in North Macedonia is the patience of the people and their engagement to really stand still and continue on the preventive measures. So the countries who have been able to make it quickly and to make it better and to really suppress the virus transmission. I say suppress because we don't know how long the virus is going to be transmitted. And as long as there is one place in the world where the virus transmission is happening, we will still be in danger. So what I'm saying is that the main success will come from the understanding of the people and following up the measures that have been put in place. And nobody can decide for you. Nobody can decide for the individual. We do not want to go back to the restrictive measures. Nobody wants to go back to this. We are really disappointed. We want to live as normal as possible. We want to see the economy coming back, but we have to contribute to that. We cannot just say it's a fallacy, it is not true. It is a reality, and we have to face it. And we are asking simple measures. Keep a distance, it's simple, it doesn't cost anything. Put a mask is simple. Wash hands is basic hygiene. So I don't understand why we cannot do it.
Џихане Тавила, thank you very much for joining us.
You're most welcome. Thank you for calling me.